So good morning, everyone. Thank you for being here today as we present the Irving Police Department's new mental health response team. Before we begin, I would like to introduce our partners here with us today, without whom this would not have been possible. From the Meadows Mental Health Policy Institute is Ron Stretcher, the Senior Director of Systems Management. From the North Texas Behavioral Health Authority, we have Carol Lucky, the CEO. We have Jessica Martinez, the Chief Clinical Officer, and we have Matt Roberts, Director of Provider Relations. From Integrated Psychotherapeutic Services, we have Jessica Simmons, our Clinical Manager. From MetroCare Services, we have Marlene Buchanan, our Operations Manager. From the Child and Family Guidance Center, Amy Cunningham, the Program Director. From Baylor Scott and White Medical Center of Irving, we have Stacy McClinton, the Regional Director. From Adapt Community Solutions, we have Alyssa Aldrich, our Program Manager. The Irving Municipal Courts is represented by Judge Rodney Adams, and the City of Irving is represented by Ashley Miller, Social Services Coordinator. The need for this team has been building for the last several years as more and more of our officers' time has been devoted to responding to calls for service related to persons suffering from a mental health crisis. With a decrease in state and federal resources to assist our residents who live with mental health needs, the demand for local law enforcement to manage those needs has increased. Unfortunately, what we know to be true is law enforcement is not best suited for managing those needs. However, because we are available 24 hours a day, 7 days a week, and are only a 3-digit phone number away, we are often the ones that respond. In 2018, the Irving Police Department saw a 17% increase in calls for service related directly to mental health. There was an 18% increase in mental health apprehensions, what we call APAOs, where a police officer has determined that a person is in a mental health crisis and poses an immediate threat to themselves or someone else. These persons are not taken to jail, but to a mental health facility to receive treatment. Of our 710 APAOs last year, 55% of them involved individuals between the ages of 10 and 29. 2 addresses alone in Irving accounted for 30% of our behavioral health emergency calls for service, and 236 arrestees booked into the Irving jail in a 3-month period were identified with possible mental health service needs. As these statistics demonstrate, the need for this team has never been greater. Our response to the mental health crisis could not remain status quo. The demands on the time of our first responders was too great and took them away from their other responsibilities. We had to find a way to decrease the demand on our time, provide better resources for our residents with mental health service needs, and divert those in crisis away from the criminal justice system and into care and treatment facilities. It was with this goal in mind that Assistant Chief Brian Redburn began working with the Meadows Mental Health Policy Institute to design a response to this issue. Over the last 2 years, they worked to identify grants to assist in funding the program, formed the first of its kind police department-led behavioral health leadership team, recruited a program manager, a clinician, and police officers dedicated and passionate about serving our residents with mental health needs. I would now like to introduce Carol Lucky from the North Texas Behavioral Health Authority to speak on their involvement with this program. Carol.
Thank you, Chief Spivey. Thank you for having me here today. Thank you all for coming. As the CEO of the North Texas Behavioral Health Authority, we are the state-designated local behavioral health authority for the counties of Dallas, Ellis, Hunt, Kaufman, Rockwall, and Navarro. We're responsible for developing a set of mental health and substance use services for our communities, and we use primarily state funds, but we also get matching funds from our individual counties. In Texas, that doesn't even come close to meeting the need. And we're really excited to be working with Irving right now under the Behavioral Health Leadership Team, because we're taking a system where we have limited resources. We definitely have a need for mental health services, but this community is rich in commitment and it's rich in ancillary services that sometimes we don't work together. The BHLT team, the Behavioral Health Leadership Team here and working with Irving, is pulling that collaboration together. We're working together to strengthen what we have, to create a system that isn't just one box here, one box there, but an interconnected system of miniature communities to work better to serve our individuals. So where there isn't resources, where resources are limited, if we pull them together and work together, we think we can do a better job and strengthen and serve the community better. Irving, I believe, is the first city that has really stepped up to jump into this behavioral health leadership process. We do have a county process as well. And I think together we can start working with our individual communities to see what we have, build on our strengths, and create a better tomorrow for our individuals we serve. That said, getting to the specifics of what we're doing, I'm going to introduce to you Jessica Martinez. She is our Chief Clinical Officer with North Texas Behavioral Health.
Thank you, Carol. So we have partnered with Irving PD and local clinics and Irving nonprofits to provide a dedicated NIPA care coordinator. The care coordinator will be focused on the jail and local ERs here in the city of Irving to provide coordination of services. Our care coordinators work to bridge the gap in services at the point of crisis with the multidisciplinary team when they get the call, when the person is releasing from jail, when the person presents to the local ERs. The care coordinator will perform the complex coordination of assessments to eliminate barriers to transitioning crisis services to the outpatient services. The care coordinator here in Irving will coordinate with the mental health departments, the internal departments, the law enforcement, state and local hospitals, the community agencies, and the other organizations. The care coordinator will collaborate with the other NIPA staff currently co-located in the inpatient psychiatric facilities, crisis residential centers, medical and psychiatric emergency departments to provide follow-up services in the community with the provider and/or the MDD team. Thank you for being here today. We at NIPA are thrilled to be part of improving the care here in Irving. And with that, I'm going to introduce Jessica Simmons with IPS.
Thank you. Thank you, Jessica. So yes, IPS is an outpatient behavioral health clinic, and we are currently the only clinic actually located in the city of Irving that is providing services to the indigent population. We are located in the Human Services Building at 440 South Nursery Road on Suite 101. That's also where the Irving Cares located as well, if some of you are more familiar with that. In Irving, we are able to provide both clinic-based and community-based psychiatric services. So when an individual would come to our clinic, they can receive same-day provider appointments where they can get a psychiatric evaluation and get connected with their mental health medications. They'll also get connected with a psychiatric case manager who's going to help them with community-based wraparound services and with things such as obtaining stable employment, stable housing, and things of that nature. At the clinic, they'll also have access to individual mental health counseling, psychosocial rehab, and then we'll also be able to help link them to substance misuse services if that's something that they're needing as well. In order to schedule an appointment, if someone is not coming in through the MHRT team, they can send an email for and then take appointment at irvingtogether@ipsrecovery.com. And then we will contact them that way from there. And we look forward to our continued work with the city of Irving. And I'm going to pass it off now to City Councilman Kyle Taylor.
Good afternoon. Thanks everybody for being here. This is a really proud moment for the city of Irving. I want to thank Chief Spivey and the police officers, city staff. I really want to take just a second. There's several of my fellow city council members here, Al Zapanta, Alan Meager, Oscar Ward, Phil Riddle, that have played an integral part in supporting this program, making sure that we're able to get this program off the ground and to work. Been a lot of help. Chris Hillman is here, our city manager. I appreciate his support in this program as well. This is a great another opportunity which the folks who run the city of Irving have taken the time, put something together to take care of our citizens. I can't be more proud of that, what we have done for our citizens, how this team has come together, how this team has worked to make our city better. The officers that have stepped up and have been part of this behavioral health leadership team, to me, are trailblazers in this because they are stepping up and sawing need. They wear that uniform to serve, and they are really truly serving our citizens. So I cannot stand here and be any more proud, not only to be the city councilman, but just to be a citizen of the city of Irving and what we have put together and we have done today with the help of these people. So to everybody, I really do appreciate everything that's been done, and I'm looking forward to great success from this. Thank y'all.
My name's Ron Stretcher. I'm with the Meadows Mental Health Policy Institute. I kind of have a unique perspective. Before I joined Meadows, I spent several years with the Dallas County as their criminal justice director, worked closely with police and others, and also spent some time on the board for NITBA. About 3 years ago, I was invited to a public health committee of the city council. I thought I was going there to kind of give a nice little overview and talk about what we do. I lost a little flesh on that one because I came away that Irving was serious. They wanted and needed services in the area and were prepared to step up and partner to do what was necessary. So since that time, this project has come together. And I want to join everyone in expressing thanks, but I want to go a little bit further. This required significant commitment from the partners and some faith that things would work out. These programs are not easy to do. Public safety is job one, and integrating safety into the care for folks is hard to do. It takes a commitment. It's easier just to keep doing what you're doing. So huge commitment to the police department and their leadership for making this happen. City leaders the same. Irving's no different than the rest of us. There's not money lying around everywhere. You have to make hard choices about your resources. But consistently, leadership stepped up and said, this is important. We're going to make this happen. No, there was not a clinic service here. IPS stepped up and said, okay, I don't know exactly what it'll look like. We'll figure it out. We'll make it happen. NITBA steps up, hey, we're not flush with, but we can free up some money for some strategic help. So that kind of faith that we're going to work as partners and make this happen is what really led this to come together. This is an important step for the community of Irving. From here, you've got a clinic service. Spread the word. Let folks know whether somebody's having a little bit of trouble and needs a little bit of help, or somebody is in serious meltdown. There's somebody here to help now. And I can tell you personally from years of working with the folks at IPS, they're dedicated and they're going to want to do a good job for you. And then our other partners, Child and Family Guidance, MetroCare, Adapt Community Solutions, have all stepped in and offered what they can have. So here we are today with an excellent starting off point. It is not the end destination, it's just a beginning, because Meadows Mental Health Policy Institute wants Texas to be the place where people get the right care when they need it, where they need it. And what's happening in Irving today is a critical point. So if we could just applaud ourselves for what everyone's done here. It's big time. So as most people will tell you, they'll ask, hey, do you mind coming and making a few remarks? And I say, that's not the problem. Getting me to stop is. But I will finish, and I believe, Christina, we want Chief Spivey to close us out.
Thank you.
All right, thanks so much.
So thank you very much, Ron. Again, I would like to thank each of our partners that are here today. I would like to thank you for being here today as well and covering this great event for us, getting our message out, helping us communicate what is going on in the city of Irving, what the Irving Police Department's doing to address the mental health crisis. I want to thank my team, my police officers, my clinician, who are truly going to be the boots on the ground that are providing the services that our citizens need. It's not unusual for police departments to form specially trained teams to better address the mental health needs of their community. What makes our program unique is our partnership with Integrated Psychotherapeutic Services in creating the only outpatient mental health clinic here in the city of Irving, the addition of the Jail Navigator Care Coordinator provider by the North Texas Behavioral Health Authority to assist with the continuity of care of individuals that need mental health services, and the police-led behavioral health leadership team. I believe what we've created can be the model for other cities and other police departments to follow in their pursuit of a response to the mental health crisis facing our nation. With that, I'll open it up to questions.
Chief, can you explain the steps or the procedures that are going to be followed once a person with mental health issues is identified in the community?
So our response will be, if our team is on duty and working, they'll respond to that call for service. They'll assess the situation and determine where to divert that patient, whether they need immediate care, whether they just need access to services, what needs to be done at that point. Our clinician and our team of trained officers will make that determination, as opposed to what we do now. We send police officers who don't have that specialized training, who don't have that clinician with them to try to assess that, which many times leads to those APOW arrests that I was talking about, where we're having to take someone and force them into services.
Chief, can you talk a little bit about the training that they go through to get this designation?
I could. I think it would be better if it came from them because they've actually been through the training. Where's Chief Redburn? Chief, you want to talk a little bit about that for me? Sure.
Chief Redburn, if you could give us your full name. Brian, B-R-I-A-N, Redburn, R-E-D-B-U-R-N. So, just off the top of my head, there's a TCOL prescribed training specifically designed to enhance mental health service response for police officers generally. Crisis intervention type training that the entire police department has. These officers have that training, and in addition to that, our program manager at the outset of this program arranged to have specific training designed just for this team. So, for example, de-escalation tactics was a part of that training, and that was provided by the North Texas Behavioral Health Authority. So, above and beyond that baseline 40-hour training that for CIT, these officers also went through several days of additional team-specific training that our program manager was able to arrange with our partners.
I think in conjunction with that, we also partnered with several cities who have already established these types of teams and had our police officers go ride out with them just to get an idea of what kind of service delivery is expected, to pick up on the pros and cons of how those other agencies are dealing with those crises. All right. Thank y'all all again for being here.